Hi, I'm Chelsea from Vail Health, and today we were talking with Dr. Kate Schuetze and a little bit about her professional journey and work story. So can you tell us a little bit about your history?
Oh yeah, I'd love to. So I'm from Colorado originally. I'm a native, and I went to undergraduate at CU Boulder. I studied molecular, cellular, and developmental biology, which is a mouthful. Sprinkled in some biochemistry, and it was great. I also played soccer there. That's where I met my husband. He was on the ski team, and then I stayed in Colorado for medical school, which at the time the University Medical School was at the time in Denver, since has moved out to the beautiful Schuetze campus. And then I went to Michigan, which was a very conscious and a very important part of my training. I did my internal medicine residency at University of Michigan, knowing that I wanted to come back to Colorado. It was always my dream and my plan. My family's here. I love it here. But I think it's really important to train somewhere else at some point. You know, there's different styles. A lot of what we do, you know, there's different ways to do things. And I think it's nice to see how something is done elsewhere. I think it expands your perspective and ultimately made me a better doctor. So after Michigan, then kind of as planned, I came back to Colorado. I did my general cardiology fellowship at CU. And then I did a focused interventional cardiology research fellowship, followed by a formal interventional cardiology fellowship. I wrapped that up in 2018 and then took a position with Vail Health up in northern Colorado, practicing in Fort Collins, Greeley, and Loveland. And that was awesome. I was the head of the vascular medicine program up there, and also one of only two of us who do complex coronary interventions, high-risk coronary interventions. And so that was a great experience for me. It was a really unique opportunity to get really high volume, a lot of experience honing in my interventional skills in a relatively short period of time, and ultimately is what allowed me to be able to now transition to a smaller community. It's always been my husband and I's dream to live in the mountains, to raise our kids here. And so the fact that we were able to come back to Vail was fantastic. I started here in January 2022. And so it's been really fun getting to get to know the community, get to know the hospital, and set down some roots.
Yeah. Since you've been in the mountains and with Vail Health, are there any unique challenges to being a cardiologist in a mountain town?
Absolutely. Absolutely there are. And I would say that some of these I know, and some of them I'm still learning. There's challenges that are common to any rural location. Access to care is probably the biggest. There's a lot of barriers. There's geographic barriers, there's social barriers. And we're constantly trying to figure out, because it's our job as healthcare providers, how do we make that easier for people? How do we make it easier to get healthcare when they need it, where they need it? There's also really specific challenges, I think, in this particular community. People think of cardiovascular disease as being isolated to patients that lead an unhealthy lifestyle. They are smokers, they're diabetics, they don't exercise, and that's just not true. Cardiovascular disease is widely prevalent in the world and in the United States. And there's a lot of risk factors that people can't control for. And so I think trying to change the mindset of, well, this can't happen to me because I live such a healthy lifestyle, to, no, I should listen to my body. And there's things that I can't control, but it's okay. I've got a team here that can help me and help manage this disease, is actually a pretty difficult transition for a lot of people. Also on the healthcare side, getting healthcare providers to recognize that just because somebody doesn't have the classic risk factors that we think of, we can't limit our focus when we think about what might be wrong with a patient based on their risk factors alone. So those are unique challenges. And then there's some really kind of, I wouldn't even call them challenges, but benefits. You know, we're in a small community, and it's awesome. I love it. And it's very cool that when I see a patient, more often than not, my daughter hangs out with their son. Right. You know, my husband works with their spouse. You know, there's some sort of connection there. And I see people at the grocery store. I see people on the ski chairlift, you know, and that's a very cool thing. And like I said, I don't know that I would call it a challenge, but is it unique to this population? Absolutely. So those are just some of the things that I've seen that are very different practicing up here.
Yeah.
Well, thank you so much for joining us today and answering our questions.
Absolutely. It's been a pleasure.